Okay, welcome back to another lecture. Today, chapter 41, Terrorism Response Disaster Management. Now, before we get started, I'm just going to get this out here. I'm not going to pretend like I'm an expert in these situations because realistically, these are, frankly put, a nightmare situation that don't happen that often. Not to say it's impossible. That said, we will cover things like Asher situation or active shooters, which unfortunately in the country we live in, or in the United States rather, is something that does show up from time to time. So we'll get into it, but just keep that in mind. Like, I'm working my way through it, but a lot of these things I've obviously never had exposure to because I haven't had to deal with it as a terrorism type response. Now, let's get going. So, you may be called to respond to a terrorist event during your career. We live in a volatile world and a volatile time. Anything can really happen at any time. So just keep that in mind. This is something that low likelihood, but never impossible, okay? Now it's difficult to plan for and anticipate a response to many of these because once again, they're not super high frequency, but there are several principles that we can apply to these responses. So terrorism as a whole, when we talk about terrorism, this is not like it's something new, right? Like, obviously, United States, the massive terrorist attack was about 24 years ago at this time, right? But this is something that's been going on since the earliest of civilizations. Now, terrorism as a whole involves violent acts or acts dangerous to human life that violate federal or state laws and appears to be intended for a few different purposes. Those purposes: intimidate or coerce a civilian population, influence the policy of a government by intimidation or coercion, once again, and then affect the conduct of a government by mass destruction, assassination, or kidnapping. Now, once again, this does happen around the world all the time. It's just here we have not dealt with this, at least in a recent time frame. Now, international terrorism occurs primarily outside of the United States. Okay, so anytime we're talking international, we're talking outside of our country. If we're talking about domestic terrorism, that's going to be closer to home, right? So in the United States. Now, only a small percentage of groups will actually turn to terrorism to achieve their goals, and we'll cover some of those. Some different groups. So religious extremist groups or doomsday cults, they have a potential for it, may participate in apocalyptic violence. If you think about it from, putting yourself in their shoes as safely as you can, right? If you and your beliefs are so staunch that the world is going to end, in their mind, it makes sense to them that they may as well kind of drag people with them, right? Now that's pretty broad and that's a little bit maybe even naive, but that's kind of the perspective I see from this. Now, extremist political groups, this is something that happens internationally fairly frequently, seeks political, religious, economic, or social freedom. So they're working for their society. There's cyber terrorism. Now this is going to be something that typically is going to, if they were to do something cyber terrorism wise, it would be something to control basically an avenue that could affect multiple people. So for example, like dams, as an example. If they were to hack into a dam and open up a dam, that's going to cause problems for the city below, right? But attack populations, technological infrastructure, and then single issue groups, so including anti-abortion groups, animal rights groups, and anarchists, racists, eco-terrorism. All of these are potentials if we're talking about the who is going to cause this. Now, once again, this is broad. This is something where it's hard to be specific because everything seems to have its own reasonings behind it and rationale. These are just examples of groups that may be at the root cause. Now, occasionally we have these lone wolf terrorist attacks, right? So if we're talking active shooter events, also known as Asher, A-S-H-E-R. But a lone wolf terrorist attack, frequent threat in the United States. Unfortunately, that is something we deal with fairly frequently as an active shooter. Now, the motives of the attackers are not always clear. And these attacks may target schools, music festivals, shopping centers. They're all on the potentials. I myself have been not directly involved, but in the county I work in, we did have a shooting at a local mall here. So that is something that we did have to kind of get a mass response for, and it did bring to light a lot of the holes that were left because of a situation like this, because no one's planning on this on their average every day. Now, many lone wolf terrorists attack involves firearms rather than explosives. Okay, so this is going to bring forth things like gun laws, mental health, education of the public and first responders on how to treat casualties. I don't want to get into this because this is obviously kind of a murky topic, and this is something that can really make either side of the coin a little bit angry. But it is something that we need to consider, right? And especially as first responders, we are going to be the ones who are the adult in the room. We're the ones who are in charge in these situations. Now, the Hartford Consensus recommends using the acronym THREAT. Okay, so when we're dealing with a potential active shooter, so THREAT stands for threat suppression, hemorrhage control, rapid extrication to safety, assessment by medical providers, and then transport to definitive care. So for us as EMS or first responders, right? Threat suppression, is there a risk to myself or others, right? Obviously a threat to others is very present, but we can't help other people if we ourselves are in danger. It's kind of a hero complex killing concept, but it is something that does need to be understood, right? Because if you go into this situation and it's not cleared safe enough for us to go in, we run the risk of adding to the casualty list and then drawing more resources. Hemorrhage control, stop the bleeding. This is going to be trauma, right? So plug the holes, put the Band-Aids on, quote unquote Band-Aids, right? And then let's get them going. Rapid extrication to safety. Usually in these type of situations, you will have, if you've watched our past lectures with the hot, warm, and cold zone, usually there'll be some variation of a cold zone so that we can do medical care there. And then assessment by providers with transport to definitive care on the list. Now, EMS crews may be equipped with ballistic vests and helmets. When I first started my career, they actually here locally did roll out bulletproof vests and helmets for us to wear in certain events. Fortunately, I never had to put them on very frequently. More often than not, it was just sizing it in the morning when I got to work on the off chance I needed it. But it is something that you may have to contend with. Now, you may be paired with law enforcement to assist with the treatment and evacuation of injured people from an active scene. Depending. Now, here locally, we have what's called our TAC Med team. They are a group of medics that are associated with SWAT teams. Now, the downside is that you got to remember that the response for these TAC Med members or these special response teams can be delayed. If they're on shift, they got to leave. They got to go somewhere else, get their equipment. They got to get back to wherever this active incident is going on, and that can take time. Which the unfortunate part of that is that the average active shooter event ends in about 90 seconds. So it's one of those things where by the time we get everybody loaded and ready to go, we're going to be behind the 8 ball, okay? And then intra-agency training is a key component. You're going to be working, especially in a big event like this, you're going to have to work with your fire departments, work with your law enforcement. You may even need to call mutual aid for other EMS systems if your system itself is too taxed and stretched by this. So you are going to have to train with these folks as well. Here locally, we did do ASHER trainings, or active shooter trainings, working with different agencies so that everybody was on the same page if the worst case scenario should show up. Now, next one, we'll talk about weapons of mass destruction. Now, we're going to go through different types. Once again, I'm not going to pretend like I'm an expert in this because, frankly, I've just never seen a lot of it because I've been fortunate enough to not have to deal with this in my career. Now, also called weapons of mass casualty. Now, any agent designed to bring about mass death, casualty, or massive damage to property and infrastructure is deemed a weapon of mass destruction. So a couple of mnemonics to help with the kinds of WMDs or weapons of mass destruction you'll see. So there's Be Nice and then CBurn, right? So Be Nice, biologic, nuclear, incendiary, chemical, or explosive. Those are all going to be considered a variation of a weapon of mass destruction. And then CBurn, chemical, biologic, radiation, nuclear, explosive. So they're similar. They should both be utilized because if you think about it, right, if we even look at incendiary and then explosive, there's things that are not covered in each of them. So by using both of them, you're covering all of your bases when you're considering a topic like this. Now, the explosives tend to be the preferred weapon, right? So there are different types of explosives. Some of these may have chemical agents or biologic agents that can increase the casualty load. So chemical agents consist of vesicants. Vesicants are going to be blistering agents, respiratory agents, so choking agents, things that maybe will simulate some sort of swelling, massive swelling to the airway. Nerve agents, and then metabolic agents are going to be on that list. And then once again, biologic, right? So biologic, typically that means derived from natural life forms, right? Or is naturally occurring. So they will include this with their weapon. So biologic agents are organisms that cause disease. So the primary types, viruses, bacteria, toxins, and depending on which type, which we'll get into these, they all have different responses, and they can activate into the body differently. So nuclear and radiologic terrorism. Only 2 publicly known incidents of nuclear, right? Hiroshima and Nagasaki, that's going to be World War II. Now these materials are far easier for a determined terrorist to acquire and require less expertise to use. This is why they're known as dirty bombs, right? So dirty bombs can cause widespread panic on top, of their lasting effects. Now, when it comes to our patient care, when we're talking about terrorism response, the basic foundations of patient care are going to be the same. We're going to treat as best we can, and it will vary, right, depending on the circumstances in front of us. We may need to move people. This is where having that triaging system, the green, yellow, red, black, is going to start playing a role if it's safe for us to go in there. But this is another aspect, is that it's going to take us, or it's going to require us to have a higher situational awareness, because things happen, right? And there are instances where there are secondary explosions, which we'll get into that here in a moment, that have been placed there for first responders, right? On the East Coast of the United States, I know there have been bombings where, I want to say it was the Boston Marathon bombing. They had the perpetrators had also put bombs inside of dumpsters so that when fire crews responded, they also would be implicated into this. Now, recognizing is a big part of this, right? So planning of acts of terror is usually covert. It's not something that we are going to be inertly made aware of until, unfortunately, things start to pop off. This is something that goes off, or that goes on above our heads more often than not, so that that's why we have so much intelligence agency type stuff around this country. All right, so you must know the current threat level issued by the Department of Homeland Security. And I know dispatchers have their own set of protocols that will assist with this for the first responder groups. Now, the National Terrorism Advisory System, or NTAS, alerts from the NTAS contain a summary of the threat and the actions that first responders, government agencies, and the public can take to maintain safety. It's kind of our generalized umbrella for information. But you got to remember, this is as they get this information, and sometimes they're not always going to get it immediately. Okay? Now, on every call, you must make the following observation. What type of location are we at? What is the call type? Number of patients, victim statements, and then pre-incident indicators. Okay, is there something going on that is kind of raising red flags for you? I heard a story from a friend of mine who's also a medic when he was up in a different state here, that there was an arsonist in the area who was calling in false fires and timing response times to those areas so that they could go to the opposite end of the city or the area and start causing more fires, right? So that's something where they are going to be watching us. So keep your head on a swivel, right? If something doesn't make sense, pay attention, right? Report what you see. Now, response actions. So first thing, scene safety, right? We always preach, scene safety, scene safe, BSI, PPE, jazz hands, all the 9, right? Before every scenario we do, but this is something where it becomes very real. Okay, so stage your vehicle at a safe distance, and then wait for law enforcement personnel. Once again, we cannot go in until these areas are cleared for us to enter. Okay, if you have any doubts on this, don't enter. Get law enforcement involved. Now, ideally, the best location is going to be upwind and uphill, okay, as best you can. That's so if we have some sort of agent that is, maybe a gaseous agent, we're upwind of it, it will go downwind, so it's not directly affecting us. If it's something where it's more of a liquid, if we're uphill, it's not going to come up at us because of gravity, okay? Now, secondary devices, like I mentioned, additional explosives set to explode after the initial bomb. It's not unheard of for them to set up secondary weaponry or explosives on the off chance of taking more people down with them. Okay, so safe location, if we're talking about this vehicle here, right? This looks to be some sort of tanker truck. It could be fluid, could be gaseous, hard to tell from this limited imagery. But notice where the ambulance is, right? It's a little close for something that's that big, and if we have compounds leaking out, something to be aware of, right? Because now we're implicating not only ourselves, but we might drag this around with us as the ambulance drives around or drives away. Now, responder safety. The best form of protection is preventing yourself from coming in contact with the agent. I feel like that's pretty obvious. Do your best to stay away from what's going to be the problem, because we don't want you to get involved. Because once again, if you get involved or you get affected by this, you run the risk of being a casualty yourself, drawing more resources, causing more problem. And if we go down ourselves, and if we're going to even go back to that secondary device, right? If you go down yourself and then you have to call in more resources, you're putting more of your crews, more of your friends in danger, okay, or your coworkers. Now, contamination occurs when you have direct contact with the WMD, and then cross-contamination occurs when you come in contact with a contaminated person. So decon is going to be huge depending on the circumstance, right? But make sure that they are as decontaminated as possible. That way we are not, once again, implicating ourselves and then bringing this into an ambulance or into an apparatus where we're now enclosing that into a space and infecting more people. Now, the notification procedure. Notify the dispatcher the nature of the event, any additional resources that may be required, an estimated number of patients, and then the upwind or optimal route of approach. Okay, you may have to put your hand outside, feel where the wind is coming from, go the direction towards the wind, right? We want to be upwind of everything as best we can. Establish a staging area. Make sure you're far enough away where you can have other apparatus come and wait with you before things are cleared out. Now, trained responders and PPE are the only persons equipped to handle the weapon of mass destruction incident, okay? They are specialists in this situation. They are the ones who make the rules a little bit, okay? We do not go in until they give us the all clear to go in. We may need to establish command. Now, it tends to be the first person on scene until senior leadership shows up, in which case they will likely take over. But it is something that we need to get that established. The quicker we get a command set up, the more we can orchestrate, the easier we can communicate, we can kind of get our ducks in a row a little bit more. Now, you and other EMTs may function in a few different avenues. You may be medical branch directors. You may triage transportation, or triage treatment transportation supervisors. You may be a logistics officer, command or general staff, right? And it all depends on who's there. Like I said, now most senior leadership tends to take this role on, but if you're the first on scene or even second on scene, it's not crazy to say that you could be wrapped up into one of these roles, okay? And then reassess scene safety constantly. If we're worried about a weapon of mass destruction, we're worried about a terrorist type event, you need to be assessing constantly. Keep your head on a swivel there, okay? Reassess. And this is an important component of your situational awareness. As you become more comfortable in this field, your situational awareness does increase, but it is something that you need to be paying attention. You need to be scanning constantly, and that's just even in regular calls. Here in the United States, it's not crazy for us to go into a situation. We go into a respiratory call, and there's a gentleman or a person with a loaded firearm next to them, right? That's something that we may have to contend with, but you want to catch it and see it before it becomes a problem, okay? So keep your head on the swivel, keep your situational awareness high. Now, there are a couple of different chemical agents that we'll get into. Like I said, not an expert on this, but we'll talk about them. So liquids are gases that are dispersed to kill or injure. Now, there's persistent and non-persistent agents. Persistent agents can remain on a surface for long periods. Non-persistent agents evaporate rapidly. So that's kind of that non-volatile versus volatile. Volatile agents evaporate quickly. Non-volatile agents, they have to have some type of equipment to make that, to stimulate that gaseous response, to force that reaction. Now, routes of exposure to how the agent is most effective and how it enters our body, right? So agents with vapor hazard enter through the respiratory tract and form in the form of vapors. You're breathing this in, right? So it's in the air you breathe. Agents with a contact hazard or skin hazard give off very little vapor or no vapors and enter the body through the skin. So that tends to be where that volatile versus non-volatile starts to show up, right? Volatile being one of the vaporous ones, non-volatile being the contact one. Now, vesicants, once again, these are the blistering agents. The primary route is through the skin, right? We need to have contact with that. So if vesicants are left on the skin long enough, they produce vapors that can then also enter the respiratory tract. So they're going to be kind of a double threat there. They're going to be damaging to the tissue. They're also going to be potentially damaging to our respiratory system. They can cause burn-like blisters to form on the victim's skin and in the respiratory tract, and then usually cause the most damage to damp or moist areas of the body. If we think about it, your respiratory tract is always moist, right? Inside of your body has an ambient wetness to it that is the, unfortunately, perfect conductor for these. Now, signs of vesicant exposure to skin. If we see skin irritation, if they're saying they have burning going on, if there's redness visible, those should be red flags. Immediate intense skin pain, formation of large blisters, gray discoloration of skin, which if you see that gray discoloration, that means tissue is dying quickly, okay? Swollen, enclosed, or irritated eyes, and then potentially permanent eye injuries. You could go blind from some of these agents if they get into your eyes, right? Your eyes are moist also. We know that these vesicants, like the vapors, can get into moist areas, right? So moist areas being your eyeballs, you could go blind. Now some examples, sulfur mustard, right? So brown, yellow, oily substance, generally considered to be very persistent, so it stays around longer. Begins an irreversible process of damaging to the cells. So this starts to kill cells at a deep level. Now attacks vulnerable cells within bone marrow and depletes the body's ability to reproduce white blood cells. Fun fact, so if it's already affecting our white blood cells, it's also affecting our red blood cells because our bone marrow is actually where red blood cells are created. Okay, so this is one of those things where they're actually affecting our normal natural processes by attacking certain cell groups. Now, sulfur mustard vapors can be inhaled, creating upper and lower airway compromise. And if we're talking about tissue destruction, airway destruction, pulmonary destruction is going to be lethal fairly quickly. Leucite and phosgene oxime, CX, produce blister wounds very similar to those caused by mustard, produce immediate intense pain and discomfort when contact is made, and then once again, they may have that gray discoloration at the contaminated site, okay? So it's directly affecting the tissue it's touching. Now, vesicant agent treatment. For mustard or CX exposure, there is no definitive antidote. These are going to be problematic, and this person is likely going to have a poor outcome. It's nothing that we can do for it, so don't take it personally if this is something you ever run into, hopefully never, that you have a bad outcome for your patient, because realistically there's nothing anybody can do, especially even doctors, okay, outside of management. Now, ensure that the patient has been decontaminated before treatment's initiated. We want to make sure 100% that they're deconned because we don't want ourselves to be involved here. If the agent has been inhaled, the patient may require prompt airway support, so be aggressive as you can, once again, as they've been deconned. Initiate transport as soon as possible, and then generally burn centers are going to be the best equipped to handle the wounds and infections. If you're in an area where you don't have a burn center, you're going to go to the highest, I would say probably trauma center in the area, and then they are likely going to be flying these people out rather quickly to the closest burn center. Now, some pulmonary agents. So gases that cause immediate harm to persons exposed to them, right? So it's going to be all breathing. Primary routes through the respiratory tract. So once inside the lungs, they damage lung tissue, and then the fluids leak into the lungs. This is also something we call flash pulmonary edema, right? So fluid being displaced into the lungs rather quickly. So pulmonary edema develops, resulting in difficulty breathing because of severely impaired gas exchange. If our lungs are filling with fluid, we're taking up space that we can exchange oxygen and carbon dioxide for our normal respiratory processes. So this is something where it's essentially they're drowning in their own fluids, okay? So chlorine gas, this is a good example of that flash pulmonary edema. So first chemical agent ever used in warfare, initially produces upper airway irritation with a choking sensation. With later, they will develop shortness of breath, chest tightness, hoarseness, stridor, right, which makes sense if it's going to be in the airway, gasping and coughing, and then once again that pulmonary edema, so their lungs start to fill with fluid. Phosgene, so product of combustion. It's a very potent agent with delayed onset of symptoms. Now, usually a mild exposure, right? Keep in mind, mild exposure. Nausea, chest tightness, severe cough, dyspnea on exertion, and pulmonary edema. If that's a mild exposure, a moderate to severe exposure is going to only up the ante with these. Now, as far as treatment goes, get them out of that contaminated atmosphere. Let's get them some real air, okay? ABC, get that as aggressive as you can. We know that they haven't been breathing oxygen. We're likely going to need to resupplement that oxygen rather quickly. Pay attention to oxygenation, ventilation, and suction. Do not allow them to be active. Now, think about it this way. The more you move, the more active they are, the more breaths you need to take to stimulate that that movement, right? You need more oxygen for your muscles. So the less they move, the less oxygen they require, which means that we can start to actually circulate the oxygen we're administering a lot more effectively. There are no direct antidotes, and then consider requesting ALS. This is something where these people will likely be intubated. They will likely have some variation of deep suction started. I can't promise any positive outcomes out of it, but that is likely going to be the treatment plan at the ALS scope, at least in the beginning, with factors to consider. Now, some nerve agents, amongst the most deadly chemicals developed, can cause cardiac arrest within seconds to minutes of exposure, right? So these are directly attacking our nervous system, which obviously innervates every system in our body, including our heart. Okay, so organophosphates, these are going to be one of the most common ones, typically found in household bug sprays, agricultural sprays. This is something where ALS will have a treatment for organophosphate. Depending on the system, they may or may not carry enough of the medication, which is atropine, needed to treat this, but it is something that we can at least help to manage until we can get them to the hospital. But it blocks an essential enzyme in the nervous system. Okay, acetylcholine is what that is, your parasympathetic hormone. Big long table, I'll let you look at it. These are some different nerve agents that are out there. Now, nerve agents all produce similar symptoms but have varying routes of entry. Sledgem or dumbbells, those are typically the presentation that we will see. So salivation, sweating, seizures, lacrimation, so excessive tearing for sludge, urination excessively, defecation, drooling, diarrhea, gastric upset and cramps, emesis, which is vomiting, and then muscle twitching or meiosis being pinpoint. And then for dumbbells, diarrhea, urination, meiosis, muscle weakness, bradycardia, bronchospasm, bronchorrhea, right? So emesis, lacrimation, seizure, salivation, sweating. They're fairly encompassing of each other, so I would just kind of pick one. I always learned sledgem, that's the one that I kind of burned to my memory, but if dumbbells makes more sense to you, use that one. Now, as far as treatments go, Duodote. Duodote is going to be our treatment. It's an auto-injector. Depending on your system, it may be carried in different places. Here locally, our supervisors would carry that for us. But it's an antidote treatment for nerve agents. It is something that we can get going rather quickly. For metabolic agents, so hydrogen cyanide, cyanogen chloride affect the body's ability to use oxygen, right? So it's another direct attack into our body's natural processes. Commonly found in industrial settings, and then lightheadedness, dizziness, headaches, and vomiting tend to be associated symptoms with these. Now, higher doses, once again, the more exposure, the more of the agent you're dealing with, the higher likelihood of worse outcomes, as well as the increased signs and symptoms load. Remember, the poison is in the dose, right? The more of the poison you have, the more effect it's going to have. So shortness of breath, gasping, respirations, respiratory distress or arrest, tachypnea, flushed skin, or tachycardia all potentially could show up. Altered mental status, seizures, coma, apnea, cardiac arrest are also potentials here. Now, with cyanide agent, their treatment, all the patient's clothes must be removed to prevent off-gassing in the ambulance. You do not want to be around this. You do not want to be inhaling this. And support the patient's ABCs, get them going immediately if antidote by ALS is not available, okay? That one's going to be a little bit specific. I will say, kind of just going back to the off-gassing in the ambulance, like I said, I've never dealt with this. I have, however, had a patient, it was out of a maximum security prison in the area, who, long story short, it took him took guards 2 cans of mace to get this patient out of his cell. I was not made aware of that until I'm in the back of the ambulance and my eyes were burning, right? Because we just took somebody who was covered in some sort of agent and we put them in an enclosed space, and now there's other people in here as well. So just keep that in mind, okay? And that was I don't want to say safe, but relatively safe in comparison to the cyanide type stuff. Anything that's going to be an off-gassing thing, we need to make sure that they are removed, the clothes are removed, we're out of there, we decon them before we transport, because you're only going to trap yourself in that area. So some biologic agents, right? So once again, usually cause illness or sickness, can be almost completely undetectable. Diseases caused will be similar to other minor illnesses, may be spread in various ways, and then dissemination is the means by which a terrorist will spread the agent. So is it going to be tied to an explosive? Is it something where they're going to gaseously release it? A disease vector is an animal that spreads disease to another animal, right? So is it going to be spread from person to person? So kind of some silly examples, but ones that immediately come to mind, right? Dissemination, terrorists will spread the agent, right? So if you think of Batman Begins, 2006, Christopher Nolan, Christian Bale, the bad guy at the end, he starts running, spoiler alert, he starts running gases up through the city streets, right, through all the sewer mains. That would be his dissemination. If we're talking a disease vector animal to another animal, think of like every zombie movie you've ever seen ever, right? Zombies infected, they go and bite someone, that person's a zombie, they go and bite someone, the next person's a zombie, so on, so forth, until we've got a problem. Now, how easily the disease is able to spread from one human to another is called communicability. Some diseases will have a higher likelihood of being spread, others won't. Now, incubation, that's going to be the time between the person becoming exposed to the agent and appearance of first symptoms. So with incubation, think of it this way, you're exposed to the flu, as an example. It's going to take some time for that virus to start showing up. Granted, it might be a day or two or even less, but there is still that incubation period. It needs to have time to spread around the body, and that's when we'll start seeing symptoms show up. So amongst these biologic agents, we'll break them down with viruses. So germs that require a living host to multiply and survive. And you can even go deeper into this, but we will not. But viruses, yeah, they spread. They need to be in a host. They basically lay dormant outside of that, if not dead. Now, invades healthy cells, replicates itself inside that, and spreads through the host. Moves from host to host by direct methods or through vectors. Direct methods being things like coughing, sneezing, fluids. This is kind of the big ones. Now, smallpox, as an example, highly contagious. You must wear examination gloves, a HEPA-filtered respirator, and eye protection. It can get into any of our orifices, right? So if it's in your mouth, nose, eyes, you have the chance for that to start spreading. And then if you have a patient with smallpox, which has been eradicated here in the United States, not to say it's impossible for things to come back, but low likelihood, observes the size, shape, and location of the lesions. If you are suspecting smallpox, you need to make sure you are notifying the receiving facility quickly, as well as making sure you, your crew, everyone who's been in contact or near contact or will be in contact with this patient is wearing all their protective gear effectively. All right, so here's kind of a breakdown of the different characteristics of smallpox. Go ahead and take a look at that on your own. Press pause or check out your book. Now, viral hemorrhagic fever, VHF, causes the blood in the body to seep out from the tissues and blood vessels. So you basically bleed through your skin. Okay, so a patient will have flu-like symptoms progressing to more serious symptoms as such internal and external hemorrhaging shows up. Once again, all external precautions as much as you can wear. And that includes not just wearing things like a surgical mask. Wear an N95, if not a HEPA-filtered mask, right? You need to wear as heavy duty of PPE as you have to keep yourself safe. And then here's going to be some more of the characteristics on this one, so feel free to check that out. Now, bacteria. Bacteria is different than viruses. Viruses need a host. Bacteria can thrive and multiply and live on its own. Right, so more complex than viruses and can grow up to 100 times larger. Now, the nice thing about bacteria is that we do have antibiotics. Antibiotics will help kill bacterial-based infection, but typically these start with flu-like symptoms. Now, another thing with antibiotics is that there are some conditions, for example, gonorrhea, if you've watched any of my past lectures, you know my joke on that, where they can become antibiotic resistant, which will cause more problems, right? It's harder for us to get rid of it. So treatments will vary outside of our scope. This is going to be definitive care management. Inhalation and cutaneous anthrax. So anthrax caused by a deadly bacterium that lays dormant in spores. Now, the route of entry is typically inhalation, cutaneous, or on the skin, and then gastrointestinal, GI, so consumed. Pulmonary anthrax is going to be amongst the deadliest, so antibiotics can be used, and then there is a vaccine available. If you've ever heard about like the anthrax scare, I don't want to quote the years because I know it was like 1900s stuff, late 1900s, right? But this is something that it has been used as a terrorist type attack before, so it's not possible for things like that to show up again. So here's your characteristics. Now for plagues, right? So everyone, when we think of the plagues, we think of like the bubonic plague or the black plague, right? The medieval times one. But natural vectors are rodents and fleas, right? So the bubonic plague itself infects the lymphatic system and creates what are called buboes. and we'll show you what those look like here in a second. But the pneumonic plague is and then there's the bubonic plague and then the pneumonic plague. Pneumonic plague, we think pneumo, lung, right? Lung infection that results from inhalation of plague bacteria. Okay, so plague bubo at the lymph node under the arm, and then plague bubo at the lymph node in the neck, right? You can see it's swollen, rounded, abnormal looking. And then here's going to be our characteristics of that. And then neurotoxins. So most deadly substance known to humans, right? So neurotoxins directly affect our nervous system, which once again innervate every system in our body, and including your brain, right? And you are not you without your brain. You're not you when you're hungry, right? Produced from plants, marine animals, molds, and bacteria. The route of entry is typically ingestion, inhalation, or injection, and it is not typically contagious, but will have a faster onset of symptoms. You need to have that direct contact to some degree, right, amongst those routes. Now, botulinum toxin, botulism, right? So most potent neurotoxin produced by bacteria. This is something that can show up even in it tends to show up in like a non-terroristic perspective in things like canned goods. That's why you're always told never to buy canned goods that are open, right, or they're damaged, because there runs the risk of botulism showing up. But affects the nervous system's ability to function. Voluntary control of your muscles will diminish, so you lose control of your body, with eventually losing all control of your muscles, total muscle paralysis, which will lead to respiratory arrest because, once again, your diaphragm is going to be affected. You can't breathe without your diaphragm. You can't breathe without your intercostal muscles. So if those are not functioning, at least naturally, right, we can probably artificially keep someone alive with things like a vent, but they will eventually go into respiratory arrest because their muscles to breathe no longer function, and then that downstream affects perfusion, which will eventually lead to death. Here's your characteristics. Ricin, now derived from mash from the castor bean, causes pulmonary edema, respiratory and circulatory failure, leading to death. It is quite stable, unfortunately extremely toxic, and the treatment's supportive, including both respiratory and cardiovascular support. There's not much we can do for this one. Definitive care, get them moving, wear your PPE. Here's your characteristics. Okay, so some roles, right? So remember what I said, if you're going to be first on scene or you're the first few people or few units on scene, your roles may shift a little bit. So syndromic surveillance, monitoring of patients presenting to EDs and alternative care facilities. You have to pay attention to patients with signs and symptoms that resemble influenza, right? Because a lot of these things start with flu-like symptoms, aren't the flu, will progress. And the quality assurance and dispatch need to be aware of unusual number of calls from patients with unexplainable symptom clusters. If we're starting to see a lot of people with the same problem, that should be a red flag, right? Think of even like COVID as an example, right? That's obviously not terrorism, but it is something where we started seeing similar signs and symptoms presenting themselves in multiple people over and over and over and over until eventually it became a pandemic for us. Now, points of distribution, right? So established in the time of need for the mass distribution of antibiotics, antidotes, vaccinations, and other meds and supplies. So you may need to help get involved on that front. Push packs distributed to the Centers for Disease Control and Prevention, Strategic National Stockpile. There's the National Stockpile. They'll send a lot of this stuff out as needed so that we can get as much good done for as many as possible. Now, push packs have a delivery time of 12 hours anywhere in the country. So we will get them as quickly as they can get to us, but 12 hours is a long time to wait when you got a lot of sick people. Okay, so let's talk about some more of these devices. So radiologic / nuclear devices. So ionizing radiation is emitted in the form of rays or particles, right? So they're shooting these little particles off all over, multiple. If you're a chemistry buff, probably a little familiar with isotopes and unstable elements, right? But alpha, beta, gamma, X-ray, and neutron radiation. So alpha is the least harmful type. Alpha tends to be think about like sunlight, okay? Now beta is slightly more penetrating. Gamma rays are faster and stronger. I redact that. Sunlight's not alpha, but I continue. Gamma rays are faster and stronger, and then neutron particles are going to be the most powerful. Neutron particles tends to be the nuclear weapons because those neutron particles get shot out everywhere, mass dispersion, and they will hit everything at an atomic level, so very, 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 very small, which can disrupt our body functions. Right? So think about alpha. Alpha can be blocked by things like a newspaper. Beta can be blocked by things like our pants, right? Gamma is going to go through all of our stuff, right? All of our clothing, our tissues, but will be stopped by things like a lead wall. And then we have neutron, which will go through anything and everything. Now, once radiologic material has been used, the remaining material is called radiologic waste, which is still harmful, right? These materials can be found at hospitals and healthcare facilities with radiology departments, colleges, universities, power plants, nuclear power plants in particular, and then chemical and industrial sites. Now, RDDs, radiologic dispersal devices, any container designed to disperse radioactive material, right? So this is where that dirty bomb concept comes back in. A dirty bomb can injure victims with radioactive or explosive material. However, the dirty bomb is an ineffective WMD, right? This is going to be something where it's not going to be as mass casualty. Still going to cause some casualties, but not as mass casualty as in comparison to like an atomic bomb. Now, nuclear energy is artificially made by altering or splitting radioactive atoms. Okay, so we're breaking things down at an atomic level once again. The result is an immense amount of energy that usually takes the form of heat. Okay, so this burns and things of that nature will show up here, right? Radiation burns. Now, nuclear material can be used in medicine, weapons, naval vessels, power plants. Nuclear energy is something that has been discussed pretty extensively, but it comes down to safety when it comes to usage of it. Now, nuclear weapons typically kept in secure facilities, right? Unless somebody gets their hands on something they should have no right having their hands on. The likelihood of a nuclear attack is extremely remote, and then the whereabouts of many small nuclear devices are unknown. Now, special atomic demolition munitions are going to be, or those nuclear devices are going to fall under that acronym there. Now, patients exposed to excessive radiation are considered victims of acute radiation toxicity or radiation poisoning, if you've heard that before. Now, effects of radiation exposure will vary depending on the amount of radiation and the amount and the route of entry. Now, radiation can be introduced into the body by all routes, right? So, transdermal, inhaled, it can be, I'm blanking, transdermal, inhaled, it can go through your nares, through your eyes, right? But it can get into your body through any medium possible. So some we'll just talk about common signs of acute radiation toxicity. So low exposure, nausea, vomiting, diarrhea, dizziness, headache, possibly can show up. Moderate exposure, first degree burns, hair loss, compromised immune system, because it's killing our white blood cells, and then cancer. And then second and third degree burns, cancer, and death for severe exposure. Moderate exposure, this is something if you have any relatives who have ever worked around nuclear stuff, especially if you have older relatives who are working, through the 60s to the 80s on this kind of stuff, where regulation was not as heavy. It is something that could show up even in a more civilian-based environment. Now, being exposed to a radiation source does not make a patient contaminated or radioactive. However, when patients have a radioactive source on their body, they must be initially cared for by a hazmat responder. They need to be deconned, okay? After decon, you can begin your ABC treatment. Once again, PPE, all bodily fluids and containers for proper disposal. We need to keep everything as isolated from touching anything that we routinely use as best possible. Now, there is no protective gear designed to completely shield you from radiation, okay? Especially like in the more EMS side of things, it's just such a low frequency, no one really does that. But even then, even if we buy something that could help us with that, there's nothing that's perfect, right? Now, the less time you're exposed to the source, the less the effects will be, right? That comes down to our exposure, mild, moderate, severe. And then make certain the responders are stationed far enough away from the incident, once again, uphill, upwind if possible. And always assume it's the strongest form of radiation and use concrete shielding. It's better to assume with these type of things. I know what they say about assuming, right? But it's always better to assume and play the air of caution there just to make sure. Okay, so incendiary and explosives. Now, incendiaries start fire. Explosive is a boom, right? So incendiaries used to start fires. Explosive devices come in various shapes and sizes. Now, important to identify an object you believe is a potential device and then notify the authorities and safely evacuate the area. Things like bomb squads will need to be called in. Now, always remember that there is the possibility of a secondary device when you respond to a scene, if it's going to be something terrorism-based, not impossible, like we talked about. Now, there's going to be some different blast areas we'll get into. So primary blast area, close, right? So direct effects of the pressure wave on the body, seen almost exclusively in the hollow organs. So those blast waves can cause hollow organs to rupture. And then an injury to the lungs causes the greatest morbidity and mortality, right? Our lungs are hollow. If they pop, we can't breathe. If we can't breathe, we die, right? That's just simple biology. Now, secondary blasts, so penetrating or non-penetrating injuries from the result of flying debris. So primary blast is you're getting hit with the meal deal, right? Secondary is going to be the stuff that's flying at you, right? A piece of metal coming at a high rate of speed and hits you is going to be a problem. Now our tertiary blast, okay, so whole body displacement, subsequent impact with environmental objects also includes crush injuries. So going back to primary, you're at the site of explosion. Secondary is debris. Tertiary is going to be you getting thrown into something. So you getting thrown into a building, or if a building collapses onto you, that's a tertiary blast injury. And then quaternary is any other injury caused by the blast. Now the physics of an explosion. When a substance is detonated, a solid or liquid is chemically converted into a gas under high amounts of pressure. This generates a spherical blast wave, right? There's a really good video on this. Unfortunately, the circumstances were unfortunate, but there's a good video explaining these blast waves. And I want to say it was Lebanon a few years back, but there was an explosion, I believe it was a fireworks factory is what I heard. I could be wrong on that, so don't quote me on it. But there's a video, you can check it out on YouTube, and you can see that blast wave, physically see it. Now, flying debris and high winds commonly cause conventional blunt and penetrating trauma, right? The higher the air around you is moving, the higher speed it's moving, the higher likelihood of it throwing stuff into you, so on and so forth. We got problems. Now, hollow organs, such as the middle ear, lung, GI tract, are more susceptible to pressure changes. Okay, so the ear is the organ system most sensitive to blast injuries. I don't know if this is true. I saw a video on it. Maybe or maybe not totally valid, but I saw a thing of like if you're worried about a blast, get as low as you can and then relax your jaw. Don't clench your teeth, and that should help your ears. Not going to save them, but it could help. Potential. Once said, like I said, it's a video. Could be wrong, but I thought it was interesting. And then primary pulmonary blast injuries occur as contusions and then hemorrhaging, right? So we bruise the lung tissue, or the lung tissue starts bleeding, which then we lose effective oxygen CO2 exchange tissue, right? Our surface area declines and decreases, which can start leading to pulmonary issues like distress, into failure, into death. Now, blast lung, most common cause of death from blast injuries. Okay, so once again, losing your lungs, hard to live. Now, neurologic injuries and head trauma are also common causes of death from these, and then extremity injuries, including traumatic amputations, are common. Tissue can be so destroyed that there's just nothing we can do for it. It needs to be completely removed, and then likely a prosthetic down the road if the person survives. Okay, so that was our terrorism response chapter. If you have any questions, feel free to leave a comment. As always, like, subscribe. Check out Idaho Medical Academy if you're interested in EMT needs, both online and in person, and we'll catch you next time.